My name is Megan Bartels, and for my critically appraised topic, I chose to investigate altitude training. So just to give a quick background on this topic, altitude training is used as a physiological training aid, and it can directly enhance athletic performance. So this is a preparation technique that's used by many high-level athletes competing on big stages such as the Olympic Games and World Championships. So the interest in altitude training has continued to grow. So research highlights physiological benefits of altitude training, such as significant increase in erythropoietin volume, erythropoietin response, which leads to improvements in maximal oxygen uptake and performance at sea level. So erythropoietin is a hormone that's produced by the kidneys, and it stimulates production of red blood cells and maintains oxygen levels in the body. So altitude training, just to lay it out for you, is training between 1,500 and 3,000 meters above sea level. So Team USA Altitude Training at Work currently has 14 locations spanning across California, Arizona, New Mexico, Utah, and Colorado. So we are looking into if it's reasonable to construct new or convert facilities into altitude training centers to accommodate for this demand and accessibility to altitude training equipment. This leads to the formation of my PICO question in young adult athletes. Does a short-term 2 to 6 week altitude training program as compared to training at sea level lead to greater improvements in hemoglobin mass? In investigating this PICO question, we were asked to conduct a literature search to locate 5 randomized controlled trial research studies that directly related to our PICO question. So in PubMed, I used keywords such as altitude training and erythrocyte, and I found persisting elevation total hemoglobin mass after altitude training in elite swimmers. So a potential role of prolonged erythrocyte survival. And this is an article published in the American Journal of Physiology in 2025 by Roman Karin, Corentin Farcher, Cones Felipe et al. So this study was done with a population of 9 high-level open water swimmers. The participants performed 2 4-week training camps, one at 1,850 meters above sea level and the other at sea level. So hemoglobin mass along with other variables were measured and compared immediately before and after the intervention, after both training camps. So all these variables, population, timeline, all of these match with my PICO question. So then I also found in Google Scholar, after using keywords altitude or aerobic performance and erythropoiesis or oxygen consumption, I found the effects of altitude in recombinant human erythropoietin on iron metabolism. And it was a randomized controlled trial that was published in the American Journal of Physiology as well in 2021 by Andreas Breenfeldt Anderson, Thomas C. Bond, Jacob Bajor et al. So this was a study done on 39 non-anemic subjects who were all classified as low altitude residents. So 2 interventions were completed. There was a 4-week baseline, 4-week intervention, so moderate altitude training, so 2,320 meters above altitude or at sea level. And then there was a 4-week follow-up period. So there were a couple different injections that were given to the subjects, but we were specifically looking at the ferritin levels with the placebo injection at altitude versus sea level. We conducted an analysis of both of these studies. So the study done on the 9 high-level open water swimmers by Karin et al. In 2025 had an average risk of bias assessment of moderate. So that was when we were looking at randomization, concealment of subject allocation, and then the study done on the 39 non-anemic subjects by Breenfeldt et al. In 2021 had an average of moderate to low risk. So across the studies, we are ultimately able to determine low certainty of evidence, as we had to break down for some of the specific categories such as risk of bias, power analysis, and consistency across the study's results. So did they have the same outcome with the intervention? When determining a recommendation based on evidence. We are looking at the desirable effects compared to the undesirable effects, and this probably favored the intervention. So the desirable effects included improved performance, improved times, so that was moderate. And then the undesirable effects could be altitude sickness, illness, hindered recovery, sleep disturbances, but that all varied based on the individual, so that was trivial. As for resources required and equity, there seemed to be some logistical and financial challenges with this intervention. However, the intervention is likely acceptable to patients, athletes, or other key stakeholders. As for the feasibility, if the intervention is feasible to implement, is probably a no. But in my final recommendation, I recommend that in young adult athletes, I suggest participation in short-term altitude training programs over training at sea level to promote an increase in hemoglobin mass. This is a conditional recommendation based on low certainty of evidence. So this recommendation is based on my findings across both of these studies analyzed, which had low certainty of evidence in answering the respective PICO question. So in the article, analyze the study done on the 9 high-level open water swimmers by Karin et al. There was a meaningful increase in hemoglobin mass following altitude training as compared to sea level, whereas the study done by Breenfelt et al. On the 39 non-anemic subjects did not have a significant increase in hematological outcomes such as blood ferritin levels. So there is future research that needs to be done, but it could be reasonable to promote the use of altitude training equipment in the near future to enhance performance.